Hey everybody, we're back again. Yours truly, Dr. Lastimado. We're at Reliable Dental Lab, and this is the Verl number 2, the second Verl to our cosmetic little tip for today. In the last video that was posted, we had talked about, hey Dr. Lastimado, how can I get better predictable aesthetic results when I'm actually preparing my veneers or crowns and things of nature. Particularly for today, we have our great patient in today, and we're doing another aesthetic spa makeover. Well, with aesthetic spa makeovers and porcelains, like here at Reliable Dental Lab, we want to be able to prep just enough so that it gives the technician enough room to build back in size of translucency and natural chromal contrast so that our porcelain veneers look very lifelike. But we don't want to over reduce and then end up being into the nerve or hypersensitivity and things of that nature. So in the last video that we just posted, to all my friends at home, hope you're having a great day today, is we learned how to fabricate one of these. This is basically a straightforward putty guide, but now it's that putty guide is going to get transferred live to our patient today, because we're shooting live, into an aesthetic verification where the patient can view the temps, if you will, which is ultimately going to be our guide for the final restoration. And also too, then it's also going to act as our preparation guide. So let's take a look at what we're going to do. So we have already fabricated our putty guide. Just a quick note, we want to mark the midline. You can just do that with a marker so that when we place this in, the idea is to get it all nice and straight. What we're going to do now is you can use any Abyss acrylic type material. We have Integrity. Thank you, Patterson, for being one of our partners in education. And Brian, a quick shout out to you, buddy. Thank you so much. But we're using Integrity today, but really any Abyss acrylic type material. We're going to go ahead and syringe all this in here and then place it in the mouth. Okay, so let's go ahead and do that real quick here. Today we're actually doing bicuspid to bicuspid all the way across for our patient today. And again, we're going to use this again for our final provisional, but this is just our aesthetic verification as well as our prep guide. Okay, so it's an aesthetic chairside prep guide, if you will. And we try to get it so it's all nice and clean. We may get some air bubbles, we'll see. Okay, just like this. Okay. Now what we're going to do is quickly go ahead, open for me, dear. Perfect. We're going to line this up with the black line. Okay. And obviously it can be a little mouthful, so if you need to trim it back, you can trim it back. We want to get full seating, just like this. Okay, kind of get the lips out of the way. If you're wondering what I'm using here, it's called an Optra Gate, made by I.D.A, sold through other companies like Patterson, for example. Works really nice. It's like your extra assistance, retracting all the cheeks and gums. For all my friends there on Facebook, you've seen those in my live surgical videos, and a lot of you who are my graduates, my live surgical training programs, we use those, so they work really nice. Come in all different sizes, just buy the variety box, and that's what we're using today. So we just place this in here, we let this fully set, and then what we're going to do is gently pop this off. And what we want to do is, obviously this was replicated off of the aesthetic wax up. We want that now provisional to auto cure to the teeth. Obviously the teeth are not prepped yet. That's really the key thing. We want to do this before we prep the teeth. Obviously the patient's nice and comfortable, she's numb, and then we're ready to go. Okay. So let's just take our instrument here real quick, and we'll just kind of toss on a mask as I work in here. So we're just going to basically feel, make sure this material's setting up, and it sets up fairly quick and open a little bit, dear, for me, as we all know. So it's setting up real hard. Great. Just works really nice. I wouldn't suggest using this old school wise with the snap or super T acrylic. It doesn't really kind of work that way, because that'd be probably be more of a mess, but you could try. But this technique is usually performed with a Abyss acryl syringeal material. So now this obviously is going to fit a little tight, so we're going to try to gently move this off. Apologize, dear. Thank you for bearing with me here, and we'll see if we can get that to stick. All right. Great, so we're going to pull this off, and voila. Okay, instant smile based off our aesthetic wax up. And what this material does, it auto cures to the teeth, right? And so essentially that's what we're looking at for eventual final restorations. Now for the patient, obviously we'll, demask her. We got our superhero, so she's got her mask on. But she's going to go ahead and verify. Obviously, she already verified on a cast, but this is kind of a cool chance for the patient to now see the aesthetic wax up in the mouth as actual provisionals. But what we're going to do next is actually we got some nice reduction burrs. We have, if you can take a quick look, we have our depth cutting burr. You can get these from Meisner, Comet, Patterson, and this is really 2 millimeters, right? 2 millimeters, like so. And what we're going to do is we're actually now from here, we're going to actually prep through the provisional, because this is our final restoration. So this is our preparation guide. And so you'll find that some areas it's subtractive, a subtractive procedure, so we're actually going to prep into the tooth. And some areas is additive, meaning that you'll prep through the provisional, the final design, and not even touch the tooth, maybe gently scuff it up. So as you go around 360 degrees, we have this guide. We also have for the anteriors, we have, I like the triple wheel. They do have single wheels. It's just diamonds. Basically, as we're prepping here, the top diamond is about 1 millimeter. The mid facial is about 0.7 millimeters, and this one is set up at 0.5, or some of them are 0.3 millimeters. And we just go all the way across. So it makes it very fast, efficient, and effective. And just like today, hopefully you found that this Verl number 2 was fast and effective for you for a nice great pearl to get predictable results. Learn more about us at www.rdl.com, rdldental.com, or you can visit me, yours truly, Dr. Lastimado, at dentalcetraining.com. Stay tuned for all my friends. Obviously, this is for my friends on Facebook, close group. Thank you very much. Like it if you like it, and post your comments down there, and let us know what you want to see. How do I do an all-on-4 jig? How do I do a removable impression? Things of that nature. Let us know. Check us out. Have a great day, and boom.